episode of Corona in the 2019 December only in Wuhan state. All of you we know that well. And today one news I want to tell. The first medical student who got Corona positive in India, that is in Kerala. Today also, again she was affected with the Corona Delta plus. So it is circle, it is going on with, like viscous circle. We want to little remind about that why. That's why the first report of outbreak from China is in 30th December, whereas in 7th January only novel corona virus was isolated, that too in China only. But 12th January, genetic code of novel virus shared among the WHO. 13th January, first case reported outside China in Thailand. And 15th January, first case in Japan. And 20th January, United States. 30th January, first case in India. Today, 15th July 2021, we are having, sorry, 14th. We have another, the first person who has got affected today also. She is affected and admitted in hospital. And 11th February, WHO renames virus as SARS-CoV-2 and the disease as COVID-19. In 11th March, WHO declares pandemic. 12th, first COVID-19 related death in India. Total number of cases in 14th April and onwards. And now we are landed with crores of people affected with Corona. And there is a lot of different type of variants has arisen in the world, like Alpha, Gamma, Delta, plus Beta. And now we are speaking about the next generation of fourth Lambda, which is, we don't know about total pathology of Lambda, but we don't know what is, it is mortality rate also. But it is going on. It is changing of variants are coming up. Mutation is very high among this virus, and it is having different names are given by WHO, like B1.1.7. Number of countries it has affected 172. Number of countries affected existed 2 weeks before 164, and Beta 122 countries it is affected and 115. Still it is going on. Delta 96 countries it is affected and still in 80 countries it is persistent. Gamma 72 countries and in 68 countries. And now we have identified in 3-4 Europe countries and 2 African countries this Lambda also. So this variants, regarding variants, our Dr. Suraprakash sir is going to speak very detailed, and he will tell more than me. Just I have giving little orientation. The Delta plus variant contains a new mutation in the spike protein. No clear evidence shows whether the Delta plus variant is more transferable or lethal than Delta. We don't know. And more than that, it is going to be affect children like that. We are getting many messages from scientists, and our government also, government of India also concentrating on children care. So every hospital, every government, state governments also preparing to treat the children. Some scientists believe that this mutation allows the virus to more easily attach to the cells, classified as variant of concern by WHO and Indian Ministry of Health. So we have to be little aware and do what we can able to do. And post-defined symptoms of Corona by February 2021 by WHO: fever or chill, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea and vomiting and diarrhea. But now because of Delta and different variants, mutation has taken place. The COVID symptom has changed, like more headache, sore throat, runny nose, fever, just like a flu. It is not going to ordinary man or doctor also, unless they are going for RT-PCR test or CT scan for lungs, we are not able to diagnose whether they are having. Common symptoms are like that: less or loss of appetite and smell, changing symptoms possibly due to emerging variants. So now next we are going to speak about little about vaccination as a person keynote address. That also going to be discussed with various people in this one. Many type of vaccines has created by world scientists, which is very palatable, because each disease condition, it has taken more than decades to identify a vaccine. But now in this corona, within 2 or 3 years, we are able to get vaccinations. But there is 4, 5, 6 type of vaccination. In India, we have 2 vaccination we are having. But the efficacy is for Fisher, 86% for alpha. Now it is less. Alpha infection is now less, but Delta and other things also. Fisher is high, having 82%. Moderna having 85%. Astra having only 31%. J&J having 57%. Sputnik have 52%. Novavax has 43%. So if we want to have highest efficacy for all 3 type of variants, we may go for Moderna or Fisher, which is also available in India. And common symptoms after common remaining symptoms after COVID, after 7 months, is fatigue. Most of the people complaining of fatigue, that is 78% people, and post-extensional malaise. We are, the PEM means here not protein energy malnutrition, here is post-extensional malaise is 76%, brain fog, which is a very dangerous sign, 55% of people, sensory motor symptoms 51%, headache for 55% of people, and mild symptoms like memory issues, insomnia, muscle aches, speech and language issues also happening, and shortness of breath for 38% of persons. So it is very latest study result, that is a Frontier has published in the month of June only. So fatigue and most exceptional malaise is also again going to affect with our cardiological, neurological, and as we said, we are seeing here muscular problems, which is going to go for sudden death during sleep like that. And more than that, approximately 10% of people who experience mild COVID symptom become long haulers, like mental health problems. They are developing anxiety, depression, insomnia, post-traumatic stress disorder. Coming to pulmonary system, they are having dyspnea, cough, impaired exercise capacity, lung fibrosis, impaired diffusing capacity, and central nervous system. Many people are going for stroke, polyneuropathy, and especially with diabetic people, there is a big confusion because of diabetes. It is happening, or it is because of COVID clinical sequelae. These all the problems are more confusing for treating people. Headache, hyposomnia, mental fatigue and confusion, brain fog and delirium. Coming to cardiovascular diseases, we are having the people are chest pain, myocardial infarction, cardiomyopathy, arrhythmia, heart failure, LV dysfunction and myocardial inflammation, coagulopathies and thrombosis, orthostatic hypertension. Gastrointestinal system, abdominal pain, gastrointestinal bleeding, nausea, vomiting, diarrhea, hepatitis and pancreatitis. All of you know very well. Now with the Delta plus, most of the people are coming with the complaints of gastrointestinal problems only. After that only they are going for pulmonary problems. Renal, glomerular diseases, musculoskeletal system, Malaysia and arthralgia, Cutaneous is very common, very common. Most of more than 10% of people going for that cutaneous diseases like skin lesions and COVID toes. Constitutional symptoms also there, like fatigue and fever. And possible biological factors that may contribute to long-term sequelae or an individualized approach to post-active sequelae COVID-19 would contribute to personalized and preventable global medicines like injury to one or multiple organs or tissues, SARS-CoV-2 being persistent in certain tissues, reactivation, they are becoming carriers, reactivation of already occurred neurotrophic pathogens such as herpes viruses, then it impacting the activity of bacteria, fungi, and parasites. All of you know, black eye and red eye, we are suffering. In India also, more than 30,000 people are affected and 3,000 people are died because of this ones. Functional redundancy in pathogen-driven process can facilitate chronic symptom development, and the activity of persistent pathogen can severe as a form of predisposition to COVID-19. And it or reactivated pathogens may induce pathological immune cell signaling or pancreas. So these are the long-term sequelae what we are human beings are going to affect in future coming days. Now, as mask, all of we are telling preventable. First one coming is mask, then repeated sanitation of our hands. Then we are telling about social distance, prevention of avoiding the transport or traveling, and keep ourselves vaccinated. Though we are telling vaccination is more important, there is some questions are still persistent, whether the vaccination what we are taking is totally covering us from all type of coronaviruses. Still it is debatable. Though WHO has given and CDC has given some guidelines for mask, fully vaccinated. We need not wear mask inside the home or inside your office once you are, whenever need not exposed to other persons. Not fully vaccinated and aged to or old. Yes, we have to wear mask indoor public places. That office we have to wear mask. If there is nobody else is there, you need not wear mask like that. Have underlying conditions that weaken your immune system, must wear. Public transportation, whether you have vaccinated or not also, you have to wear mask. Public transportation are required by federal, state, local, tribal or territorial laws, rules and regulations. We should follow compulsory 100%. Areas with high numbers of COVID-19, it is must. Crowded outdoor settings and for activities which close contact with others who are not fully vaccinated. Whether you are vaccinated or not, as per CDC and WHO norms, we should wear mask. And it is recommended N95 masks. Now 5 layers masks also coming to market, which is feasible. You can take it and wear. And especially as first line healthcare members, we must wear, and we have to educate our group members and our healthcare members to wear proper mask in whenever they are coming out of the house. And clinical and many patients with corona diseases 19 have underlying cardiovascular disease or develop acute cardiac injury during the process of illness. Last conference we have discussed everything. If anybody needs to go for this type of things, you can ask for it. And there is a strong relationship between the cardiovascular system and SARS-CoV-2. The virus could affect the cardiovascular system by several mechanisms like direct myocardial injury, systemic inflammation, altered myocardial demand-supply ratio, plaque rupture, and coronary thrombosis, adverse effect of various therapies, and electrolyte imbalances. It is a study was done by Future Cardiological, volume number 16, number 6 page. And this present with coagulation abnormalities. That's also going to be discussed by another one person, that is Mail Waganen sir. He will be going totally about this one. I think I have little oriented about our conference. This is mainly aimed to have awareness among our nurses to treat their patients, clients, to come and educate the public in various sequelae, what they may have it, and how to have watch on their each and every symptoms. Thank you. Once again, I want to thank to our management and our Dean sir and our Vijay Kumar sir and Narayana sir for giving us this good platform to conduct this series of international conferences. Thank you all. Any doubts you can raise now. Thank you all.
Thank you, ma'am, for your giving valuable information about COVID sequelae. Thank you.
Next, I'm much happy and privileged to invite and introduce our Dr. Dean Surya Prakash Rao from Narayana Medical College, Nellore. Welcome you, sir. Dr. Surya Prakash Rao, MD, Dean, Narayana Medical College Hospital, Nellore. Sir is a professor in preventive and social medicine, received training in epidemiology and biostatistics. After moving professional degree in community medicine and hospital administration. Sir's alma mater is Andhra Medical College, Visakhapatnam. Sir has served for Government of Maharashtra for nearly 25 years in various faculty positions at government medical colleges in Maharashtra. Sir has served as an officer on special duty, Directorate of Medical Education and Research, Mumbai, for the establishment and upgradation of new government medical college in Mumbai. Sir was also in charge of Medical Research Council of Maharashtra, Government of Maharashtra, Venture. Sir is qualified in epidemiology, computer technology, and infectious diseases. Sir had a rich experience as a principal investigator for several research projects funded by WHO, ICMR, SIDA, Canada, Aga Khan Foundation, and NIHM and Government of Maharashtra. Sir was also involved in field of epidemiological survey in Karnataka, Kerala, Chhattisgarh, and Maharashtra. Sir is a recipient of WHO Fellowship in Hospital Administration. Sir has vast field experience in epidemiology and has authored 8 books for graduates and postgraduates. Sir is one of the key trainers for national programs such as Integrated Diseases Surveillance Program, NRHM, RNTCP, CSSM, IMNCI. Sir is actively involved in teaching and training medical graduates and postgraduates since last 13 years. Welcome you, sir.
Am I audible, madam?
Yes, sir, audible, sir.
Thank you very much, madam, for your kind introduction. Let me at the outset thank the organizers for giving me the opportunity to share some of my views with you. And I am also thankful to the Nursing College, who is organizing this 2-day international webinar on clinical sequelae of COVID. And let me put things straight that I must appreciate Dr. Indira, the Dean of Narayana Nursing College, who took initiative in organizing this. I also welcome all the international participants, especially I must mention Haja Bibi from Malaysia, who is more than willing to participate. Welcome you, madam. And let me share some of my views before I start the actual program. COVID has given us ample opportunities to introspect ourselves, introspect into ourselves as human beings. Besides this, it has given an opportunity of information explosion. I have never seen such an information explosion before throughout my life. Such information explosion has occurred due to COVID, and most of the information I must share with you is non-scientific, no evidence-based information, but non-evidence-based information, both in print media as well as in electronic media. Even I see some of the slides which Dr. Indira is showing is from electronic media. It's not from scientific scientific journals. So there's lot of information which has come to, and this information is accessible to each and every individual. It's not only the doctors and the health personnel, it is available to each and every individual. Now everybody knows most of the facts about COVID. And this information is incomplete. I see large number of people coming to me and asking, sir, whether this Delta virus is more dangerous, how to protect from it, the vaccines will protect from Delta virus or not, and such things. And coming to my presentation, I would like to limit my presentation not in depth. It's an overview because I don't want to burden with large details of this genetic variations that are occurring in COVID virus. So I would limit my presentation to a generalist view and what is all required for health personnel who are working in the field. And let me record my sincere gratitude and applause to all the nursing professionals who are involved in both first wave as well as in second wave. I have personally seen how the nursing personnel really entered and took the risk of staying with patients in the wards and then nursing them and offering healthcare. I really appreciate the nursing community for taking such humanistic attitude. So let me begin my presentation. Can I share my screen, madam?
Yes, sir. Yes, sir. Please share, sir.
Is it visible, madam?
Yes, sir. Visible, sir. Just make it as a slide.
Right. So my topic is mainly regarding the variants of coronavirus in the recent past. As you see, corona is gradually and continuously is modifying its genetic material. The material by which it is made up of, it's gradual transformation that is happening in corona. It's not, it's constantly changing. And let me tell you that there are certain features which are outline of my lecture. So one, I would like to confine to the introduction of this variants, and then what are SARS variants, especially coronavirus, and then what are called as mutants, and what is the impact of these variants on diagnostic tests which are being used at present, and what is the impact of variants identification on public health, and what is its impact of variants on vaccines which we are using now. And then finally, we would like to have a discussion and conclusion. And I request all the participants to write down whatever they have clarifications or doubts in the chat box so that we can discuss at the end rather than raising the hand. So let me start with the introductory part of the variants. First of all, we should know about something about the viruses in general. What are these viruses? Viruses are minute biological particles which can cause disease, both in animals and human beings. And most of the viruses which we see are mainly from animals. They are all changing their species and then entering into human beings. Most of these viruses are from animals. That's why we call it as a zoonosis. And all of us should remember that there is a dynamic process going on in the virus when it enters into the host, and the host virus interface is gradually changing. As you know, the virus enters and then host would like to offer some resistance or defense. And whenever there is defense, the virus wanted to change so that it will escape the defense. So it's a dynamic process which is going on between whenever any virus enters into the host, because the host is offering certain resistance, and virus would like to escape that resistance by changing its shape or changing its contents and all. So any virus, not only corona, any virus will do the same thing. And the second most important thing which we should remember about viruses is the virus multiplication time is very small. There is a short generation time. Generation time is very, very small, and within a short period, the viruses can assume large population sizes. So all these viruses, whatever the viruses we have, they have very short multiplication time, and within a short time, they can assume large population. And thirdly, the mutations that are changes that are occurring in the virus can be sometimes protective, or it can be a defective one. Protective in the sense it will protect the virus from escaping the defense mechanism of the host. That's protective for the virus, or it can be defective for the virus. Sometimes these mutations are the changes. Mutation means it's a change, and these change can be defective, or it is harmful to the virus, so that the virus may not be effective in causing a disease. So the mutations are always not protective. Sometimes they may be defective also. This applies to all viruses. Then the other important feature of viruses is whatever virus you are having, either it may be Zika, or it may be Ebola, or it may be any other virus disease which we are facing now, they are mainly zoonotic. They are all coming from animals. And all these viruses have pandemic potential. Pandemic potential is because they have high infectivity, and they can infect large number of people in a very short period. So because of the global village concept, so people are traveling from one place to another place. So one infected person can infect large number of others. So all these viruses have pandemic potential. Not only corona, any virus which is coming from animal source, they have pandemic potential. And these viruses have another characteristic feature of it crosses species barrier. Species barrier is some species are resistant. Most of the human beings are resistant to are resistant to viruses that are coming from zoonotic. But these viruses, when they enter into a human being, they can change themselves and then they can cross the species barrier. So initially, human beings are not affected, but now they are affected because the virus is constantly changing its contents, changing its shape. So it has got the capacity, something like a Rakshas, it can cross the species barrier. And all these viruses have high morbidity and mortality. So when you talk about corona, you talk about general viruses, all these viruses have high morbidity and mortality. And new variants of a virus strain, all these viruses strains, gradually they are emerging through a process of mutation. So there are three terms which are being used in this sentence. One is a variant, the other one is a strain, the other one is a mutation. Mutation is a process. Mutation is a process, and a variant is a new strain that is happening, and that strain means it once there is a change, and that change is constantly happening, and it can produce the same variant for a long generations. Then we call it as a strain. So a new variant of a virus strain emerged through a process of mutation. Mutation is a process, and the strain is the end result. So a new variants, if they are happening, and they are constantly being infecting large number of people without any change, then it is called as a strain. So the variant is a temporary process, and then when it becomes a constant one, it is called as a strain. So process is called as a mutation, and new variants, and then the strains. The other thing which I wanted to share with you regarding general viruses is the accumulation of mutations, changes in the genetic code over time as it replicates. All these mutations, they accumulate. See, whatever genetic material they have in the beginning of the Wuhan virus or in China, the same virus has accumulated so many mutations, and whatever virus we are having, it has accumulated all these mutations, and a new strain is emerging. So there is a change in its genetic code over time as it replicates. And then the virus has got an inherent capacity of DNA repair mechanism. All of us knows whenever there is an injury, there is a repair mechanism happening in the body. The same thing applies to the virus. Whenever there is a DNA change, so it repairs by itself. So these are some of the characteristics which we have to understand, which are inherent to all the viruses, not only corona, to all the viruses that are there infecting human beings. Secondly, let us see what is happening to SARS coronavirus variants and mutations. What are this virus? What is this virus? This virus is a single-stranded RNA. We all know human beings have double helix, but whereas here it is only single helix, say single-stranded RNA, and the genomic length of this RNA is 30 kb in length, and it's a very small one. 30 kb is very small, contains 14 open reading frames encoding 27 proteins. So there are 14 open reading frames having 27 proteins, and most of the proteins which we are detecting are the spike proteins. So all these spikes which you see in the virus, there is a central central body, which is a circular form, and then there are spikes which are projecting from that circle. So these are called as spikes, and these spikes contains the proteins. So these proteins are most important because these are the binding proteins to the host cell. So we are all targeting the spike proteins. So around 11 days, new substitution are resulting in mutation or variant. Every 11th day, the virus mutates. So you can imagine how many variants we may be getting. So once it infects a human body or an animal, with around 11 days, it changes into a different one. So these mutations are quite common, and these are happening every day and day out. And there are thousands of mutations which are causing variants of concern. So there are variants of concern, which we will be talking later. What are these variants of concern? So there are thousands which are happening now and which are being detected.
Vijay, there's a connectivity problem, I think.
Yes, ma'am.
Maybe SARS side, maybe, isn't it? Yeah. Yeah, SARS. Yeah.
Sir, my voice is not audible. Please unmute yourself.
Can you hear me, madam?
Yes, sir. Yes.
Is the screen visible?
No, sir. Screen is not visible.
Let me show. There is a problem with the electricity.
Yes.
So that's why there is an interruption.
Yes, sir. Now it's visible.
Can you see now?
Yes, sir. It's visible. Sir. Slides are visible.
Yeah, that there are thousands of variants, and these variants are called as variants of concern and variants of that are available now. So the internationally confirmed variants are B 1.1.7 and B 1.351 and P1 and cluster 5. These are called as VOCs. These mutations can be classified into different types of variants, and these variants are 3 types. One is called as variants of interest, the other one is called as variants of concern, and the third one is variants of high concern. So what is this variants of concern? What is variant? Variant is a different strain. Through a process of mutation, the virus has changed its shape. It is something like Bahurupi. It's changed its content, and it is now projecting as a different one. So these are called as variants of interest. There are a large number of variants of interest, and these variants, the characteristics are, there are specific genetic markers which are changing the receptor binding. Receptor binding is, as we have talked about, the spikes which are projecting from the circular body, and these spikes are the receptor binding sites. So they will be binding to the cell of the human body, and these variants which have changed these receptor binding sites, they reduced antibody neutralization. So they escape from the antibodies. Antibodies are produced very specifically, and they have changed the antibody neutralization. Say, for instance, if the virus is projecting as a knife, and the body is having a shield, so virus, instead of projecting as a knife, it changes into a pistol. So that is what is called as reduced antibody neutralization. So we don't have any defense against the pistol, but we have the defense against the knife. So the variants of interest are the ones which changes their receptor binding, and which reduces antibody neutralization. So that's why even in vaccinated individuals, we see the disease happening because the virus has changed and it reduces the efficacy of treatment because the treatment are specific to one specific variant. It may not be applicable to the all variants. So there can be a reduced efficacy of treatment. The one thing which we all should remember is in the first wave, there's not much of oxygen requirement in patients, whereas in the second wave, large number of patients required oxygen. So the efficacy of treatment has been reduced. Initially, these patients never required oxygen to be supplemented, whereas in the second wave, because the second wave, the whole virus has changed its antibody structure, and there can be potential diagnostic impact. Potential diagnostic impact is individuals are able to diagnose through a specific test. It may be RT-PCR, or it may be antigen detection, or it may be CBNAT, or whatever it is. So these tests may not be able to detect that the individual is suffering from the disease because they are targeting a specific antigen which is there in the spike protein. So if it changes that protein, then we may not be able to detect it. So it has a potential diagnostic impact or predicted increase in the transmissibility. Once it changes its antigenic structure, then the ability to transmit from one person to another person also increases, or it may increase the disease severity. This we have experienced in the second wave. So the experience of second wave tells us that we are dealing with the variant of the disease. The second type of variant is called as variant of concern. Concern is because there is an evidence that this variant of interest is increasing in the number of individuals who are being infected. So initially, there will be very small number of people who are infected with the variants of interest. When the variant of interest increases the number of people infected, that means there is increase in the transmissibility and more severe disease and significant reduction in the neutralizing antibodies. So when these things occur, then we call them as variants of concern. I must tell you, the Delta virus, which Delta variant of corona, initially was variant of interest, but later, when it constituted more than 60% of cases, then we changed from variant of interest to variant of concern. Similarly, we have another variant called as Lambda, which is being detected recently in India. So this Lambda is now presently, it is a variant of interest. So when it infects large number of people and when it reduces the effectiveness of vaccines and when it escapes the diagnostic detection, then it is called as variant of concern. So when it infects large number of people, and then we call it as variant of concern. The third group is called as variants of high concern. High concern is the preventive measures which we are adopting significantly reduce the effectiveness of relative to previously circulating variants. There is an evidence of preventive measures or have significantly reduced the effectiveness of relative to previously circulating variants. Then it is called as variants of high concern. That means previously we were using shields to protect ourselves. These shields are able to protect only the initial variant of corona, but not the other variants. It may be Delta or it may be Lambda. Then they are called as variants of high concern. So whatever preventive measures we were using, so these preventive measures medical countermeasures have significantly reduced the effectiveness of previously circulating variants. Then it is called as variants of high concern. So these are the three types of variants. One is called as variants of interest, variants of concern, and variants of high concern. So the delta variant is now the variants of high concern and variants of concern. So what is this variants of concern? To define variant of concern, what is required is an isolate of SARS coronavirus that has a genotypic or phenotypic changes compared to the reference genome. It's called a variant of concern. So what are the implications? Why we should worry about these variants? If there are variants that are occurring, as we have talked about, there are thousands of variants, and one of the variant is Delta. Why should we worry about it? Because there are certain implications of these variants. What are these implications of these variants? A variant is, it increases the transmissibility. Now, once the virus changes its structure, then it is easily transmittable from one person to another person. So large number of people will be affected once the virus changes its structure. Then it increases the virulence. It increases the disease producing capability. So previously, large number of people, as we have studied corona, 80% are asymptomatic infections. Hardly 20% will have one or other symptoms, and 1 to 2% may be suffering from serious illness. But now, because of these variants, there can be large number of people who are showing symptoms and who are going into serious complications of the disease. So that is what is happening with variants. Variants will cause increase in the virulence, and these are not being controlled by the current public health measures. The current public health measures may be simple mask, wearing a mask, or a social distance, or it may be the other one, a shield or a vaccine. So these public health measures will not be able to control the virus pandemic. So the implications of these variants is that whatever we are doing to interrupt the transmission of the disease, these may not be effective at all. So that's why we are worried about these variants. And these variants, once we detect, they are fit for monitoring and surveillance. So they are fit to see whether they are remaining as they are or they are changing. So how many people are being affected? So this is a constant watch. So all these variants invite a constant watch by the national as well as international organizations. So what we have learned that there are three types of variants that can occur. One is variant of interest, which is the change in the antigenic structure, which can escape antibody of protection. So which can enter into the body, which can bypass the antibodies, and which can cause the disease, and which can be a very severe disease. That's variant of interest. And when the variants of interest infects large number of people, and it is a large proportion of people are affected with these variants of interest, then they are called as variants of concern. And these variants of concern, when they escape all the preventive measures, and these preventive measures cannot be applicable to these variants of concern, then they are called as variants of high concern. So these are the three types. And why we should worry about these variants? Because they increase transmissibility, increased virulence, and they are not controlled by public health measures, and they are fit to be monitored by either surveillance or monitoring. So there are certain terms which are being used in this, The definitions, some of you are interested in these definitions, so that's why I thought I should tell you something about these definitions. One is called as a strain or lineage. So these are the two terms which are constantly being used interchangeably. The strain or lineage. What is the strain? Strain is a genetic subtype which may or may not be biologically, functionally different from one another. So they are biologically the same, but say for instance, we have different strains of bacteria. So they have a common genetic one, but there are certain minute differences. So this is called as genetic subtypes. And these subtypes are called as strain or lineage. Then we have what is called as a mutation. Mutation is a process. And this process is alteration to or change in the RNA or DNA genomic sequence. So all these genomic structures are with amino acids, and these amino acids, there is a specific sequence, and these sequences will change. And these sequences, if they are changed, that process is called as mutation. So change in the nucleotide within the sequence, insertion or deletion of genetic material, and that process is called as a mutation. Then the third one is called as a variant. Variant is a genetically distinct form characterized by specific mutation. So through mutation process, we will get a genetic variant. Or the last one, the definition of constellation of mutations. Constellation of mutations is how to designate these mutations. And these designation of mutations, you can, by a person called a next strain, is they identified by year and letter. So initially, these are the ones which have been used by various scientists, that we should identify these mutations by saying year and a letter. So it may be 2020, that's the year, and a letter may be B or C or whatever it is. So that new strain introduced a method of identifying variants by writing a year and a letter. Then whatever we are following now is Rambaut et al. Is a lineage naming. Lineage is which says the genetic subtype. Genetic subtype is B1.1.7 is a genetic subtype. B1.351 is another genetic subtype. Now WHO, instead of writing this, they have named it as alpha, beta, gamma, delta, and lambda. So the constellation of mutations are now being used by various people. Initially, it was by year and letter, and later by the lineage naming. And now we are, the World Health Organization said that we should designate them either alpha, lambda, delta, and beta. So the variants that are being used and the country from where these variants have been identified. The first variant that was identified in the genetic lineage is B1.1.7, that is renamed as alpha, and it's first detected in UK. Then the next variant is beta, which was found in South Africa, and now South Africa, most of the people are affected with this beta. Then we have the gamma. These are variants of concern only. I'm talking about variants of concern. Then the gamma is from Japan and Brazil. This is the variant. Then we have delta, and this delta variant is from India, which has been reported. And these two, lambda and kappa, these are called as variants of interest. Variants of interest. Lambda variant is C3.7, that is from Peru Island. And kappa variant is B1.617.1, it is from India. So the lambda and kappa are variants of interest, and the remaining ones are variants of concern. So what is happening? So there are only four major variants of concern that are being used. So the virus changes either in its antigenicity or in its virulence, that is disease producing capability, or it is transmissibility. So what we are trying to tell you is that these variants, either it will have change in antigenicity or a change in virulence or change in the transmissibility. So all these variants will have a different antigenic change and a different virulence and different transmissibility. So most of these variants have increased transmissibility, except for the alpha, which has got increased virulence. Rest of the variants are not having much virulence. So we need not be worried about these other variants, including Delta, because there is not much of virulence. The disease producing capability is not much, but there can be increased transmissibility. That is more worried about the Delta. So the third part of my presentation is, what is the impact of these variants on diagnostics? So we have various diagnostic tests that are being used now. So we have RT-PCR, we have CBNAT, we have antigen detection test, rapid antigen detection test, or what we call it as a RAT, and then the others, antibody detection. All these are the diagnostic tests. We have a battery of tests that are available now to detect coronavirus. So how does it affect the diagnostic test? So one is, it affects the accuracy of the test. Accuracy is sensitivity and specificity. So an individual who is infected with the variant of coronavirus, suppose if you test with RT-PCR, RT-PCR test may be negative. Why it is negative? Because there is a primer which we are using in RT-PCR. It's called as a primer. Primer contains the specific spike protein antigens. So if this variant is changing its antigenic structure, it is changing its spike protein, then naturally the test which we are using will give negative results. So in an RT-PCR, there will be continuously negative result. Continuous negative results means that these tests may not be able to detect the variant. So individual is having symptoms, individual is serious, all the symptoms are suggestive of coronavirus, but the test is negative. So that's the impact of the variant on diagnostic tests. So it causes false negativity. False negative results are quite common with these variants, with the existing tests which we are having. The second one is the primer binding sites. Primer binding sites, which we are using in these tests, they change because of these variants. The short DNA sequences, there will be a mutation. If there is a mutation in the short DNA sequence, then we may not be able to detect the positivity. Then the third one is mutations in N gene or S protein. So test using, there are various tests. So we may not be able to rely on one single test. We have to use multiple tests. So thereby increasing the cost of diagnostics. So if you want to detect a variant, so we will be using multiple tests to say that the individual is infected with corona variant or not. So thereby the cost of diagnostics will increase. So tests using multiple genetic targets have to be used to detect the variant. So these are the three major effects that are happening because of variants in the diagnostic arena. One is it reduces the accuracy. That means we are unable to detect that the individual is infected. And these mutations, because the primer which we are using, the binding sequences are changed, so it may not be possible to identify individuals. And thirdly, the cost of the test will increase because we have to use multiple tests. Then let us see what is happening to the managing the impact of variants on diagnostic. How to, what are the various impacts of these variants? One is monitoring and evaluation of diagnostic tests, and we should be able to design reliable tests. So again, multiple tests are required, and design variant-specific tests and sequencing as a diagnostic test. So we are not using, presently we are using only the antigen. We are not using the antigen sequence. So the amino acid sequencing, we are not using in the diagnostic test. So if you want to detect the variant, you have to use sequencing as a diagnostic test rather than simple detection of antigen. Antigen may be the same, but the sequencing of these amino acids may be different. So we have to devise a new diagnostic test which uses sequencing. So this is what happens in case of variants as far as diagnostic tests are concerned. Then what is the impact of variant on identification, variant identification on public health? So this is most important for us to know that all these variants have large impact on public health. What are those impacts? The impact can be either in the form of the transmissibility. That means all individuals are infected very easily, higher infection rates and higher hospitalizations because of higher virulence, and then the pressure on health systems. So as you see, there's a large pressure on health systems. Even in hospitals like Narayana, we have hardly 150 oxygen beds, and all of us have experienced there is a high demand of oxygen beds. So thereby the number of oxygen beds need to be increased during the second wave. So there is a pressure on health systems once there is increased variants that are being circulated. So higher pathogenicity results in higher hospitalizations and pressure on health systems, and increased transmissibility causes higher infections, and more number of people are getting infected. So higher infection rate, higher hospitalizations, resulting in pressure on health systems. The second major effect is immune escape. Immune escape is reinfection within a short time frame. Immune escape, we may be receiving vaccines. So many people came and told me that, sir, we received a vaccine, but again, we are getting infected. We are positive. So that's mainly because the antibodies that are being produced due to vaccination are different because they cannot act on variant. So reinfection may occur within a short time frame. So this what is called as immune escape. So you give a vaccine today, but tomorrow the main objective of giving vaccination is that the individual should not suffer from the disease. But whereas if the variants are happening, the individual will suffer from the disease. So what is the use of vaccination? So these variants will escape from the resistance that is being offered by the antibodies in those individuals who receive the vaccine. So that's why people are saying whether the vaccines that are being used will be able to protect us from these variants or not. So it's not only from the main virus, they should also protect from the variants. So or else there will be reinfection within a short period of time. Then the third effect on public health is the preventive measures. Preventive measures, because the variants are being circulated in the community, so there need to be a stricter and enhanced public health and social measures. As we have seen in the initial stages, there is some relaxation of the lockdown, and when we see large number of cases happening, maybe due to the increased circulation of variants, so we have stricter lockdowns, stricter social distancing measures, and the enhanced public health control measures. So it causes strain on the civil system and public health measures. So whatever public health measures are being used, so they have to be more stricter, and they have to be enhanced and expanded to cover larger community. And fourthly, the effect is on surveillance. Whenever there are any variants, so we need to strictly watch them, monitor them over a period of time. Implementation or enhancement of genomic surveillance. What is happening to this virus? So what are the variants that are happening? Genomic surveillance is required as a public health measure. So any variant that is happening in the virus immediately calls for genomic surveillance. So in a nutshell, the public health measures are like we talked about extended lockdowns, imposing the lockdowns and incremental increase because of variants. So there's extension of lockdowns. As we have seen in the initial stages, the lockdown was only for a month, then extended for 2 months, then extended for 3 months. Similarly, in the second wave also, it was the lockdown was hardly for a month, then extended for another 15 days, then another 15 days. And now we are, for the last 4 months, we are in the extended lockdowns. So because of this circulation of variants. And there can be travel restrictions. Travel restrictions because every country wanted to protect their own people, every state wanted to protect their people. So there are various travel restrictions. People have realized that there are travel restrictions even to travel to neighboring states or neighboring cities. There are travel restrictions. So whenever there is a variant, it imposes travel restrictions and border closures. And the mask regulations. Mask regulations are important public health measures due to the circulating variants. So mask regulations. So people are saying mask becomes something like a handkerchief. Everybody, if they want to go out of the house, so we will check whether there is handkerchief or not. So similarly, we have to check that there is a mask. So mask has become a part of a body attire. So now the mask regulations are imposed to each and everyone whenever they go out in public spaces. I don't agree with the CDC regulation saying that vaccinated individuals need not wear masks. So that's improper to suggest because of the circulating variants. So masks need to be worn even if the individual is vaccinated. The main purpose is that these vaccinations which we are receiving may not be able to protect us from the variants. So there are some claims from the vaccine manufacturers that these can protect from the variants, but the protection levels are limited. So that's why we still suggest in India, it is being suggested that mask regulations need to be continued. We should not shed away the mask. And the other public health measures is quarantine. Corona has introduced a term called as hotel quarantine. And this hotel quarantine is a new concept which has come up during this Corona pandemic. And previously, we used to have quarantine in either at home or in a different place. But now, hotel quarantines and home quarantines are common as a part of national and international regulations. And school closures, these are one of the public health measures. Even now, we closed all the educational institutions because of the fear of variants. And vaccinations. Vaccinations is scheduled extended coverage of different age groups or risk populations. Scheduled extended coverage is initially, we have seen that the vaccines are offered to only those people who are above 60. Then later they changed it to above 45, and now they changed it to above 18, and now they are trying to introduce right from 0 age group. So there is a scheduled extended coverage of different age groups or risk populations. So these are some of the public health measures that can happen as a part of variant control measures. And this not only the measures which I have said, there can be global sequencing is happening globally. There are various institutes, including World Health Organization and Gavi, which are monitoring the global sequencing measures, and multinationals response, whereas all the organizations, international organizations, are initiating these responses. And there is surge testing, and national and regional responses are happening as a public health measure to tackle the variants. And finally, the impact on vaccines, as we have already talked about, there are, at present, there are 57 vaccines that have been approved by World Health Organization, so that are available. We have around 5 vaccines in India that are available, and these vaccines can be either subunit vaccines or viral vector vaccines or nucleic acid vaccines. And we are having nucleic acid vaccines of Pfizer and Moderna, and we have what is called as the viral vector vaccines. AstraZeneca and Sputnik are viral vector vaccines. The whole Variance vaccine is the vaccine which we are having from Hyderabad. Covaxin is the whole Variance vaccine, Variance which has been inactivated. That's the oldest method of preparing a vaccine. So now we have nucleic acid vaccines, because previously vaccine preparation used to take a large number of years. Because of nucleic acid vaccines, the technology has evolved so much that we are able to produce vaccines within a short period of 3 to 6 months. So finally, coming to the discussion, so there has to be a genome surveillance on the basis of robust national and international response. In India, we are part of this genome surveillance. We have national laboratories which are participating and then monitoring the genomic sequences that are happening in India. Now, what exactly is this genome sequence? Because genome sequence is one which is required for any virus, epidemic or pandemic that is happening. This genomic surveillance, it characterizes infection after vaccination or infection, because many people will say that even after receiving vaccine, I got the infection. So such people are more prone or suggestive of getting infected with variant viruses. And monitoring variants for the therapeutics, because whatever drugs we are using may not be effective against these variants, and monitoring the impact of therapy on viral evolution, because sometimes if you don't use the drug for the specified period, then that may result in production of a new variant or a resistant organism. Monitoring viral evolution of these long infection. So what is happening to those individuals who are having this COVID infection for quite a long time, maybe a month, 2 months, 3 months, they are still positive. So in those individuals, they have to be monitored for the evolution of these variants. So there is a study which is going on, and India is a part of that study that's called as Unity Studies for Genomic Surveillance, which is population-based, age-stratified sero-epidemiological investigation. So these Unity studies, even in India is a part of it, and ICMR recently called for various proposals to study these measures, either population-based, age-stratified sero-epidemiological investigation, or COVID vaccine effectiveness, or it may be assessment of risk factors, or it may be schools and educational institution transmission, maternal pregnancy and neonatal outcomes for women and neonates, or surface sampling or household transmission. These are some of the areas which are being monitored by this Unity study. And these Unity studies, India is participating, and we may be starting within the next 1 month or so all these studies throughout India. So that completes my talk on this. Variance, what is its, what are variants? Variants of interest, variants of concern, variants of high concern, and the four major variants which we are having: alpha and delta and gamma, and the recent lambda which we have. So their impact on diagnostics, because these diagnostic tests may not be able to detect these variants, and the cost of these diagnostic tests may increase, and these newer diagnostic tests based on sequencing need to be developed. Then the impact on public health, because these measures may not be sufficient to restrict the infections because of increased transmissibility. Then finally, what we should do about these variants and what measures we can suggest, like genomic surveillance, which is happening throughout the world. So that completes what is happening as far as variants of COVID is concerned. If you have any questions, please let me know.
Any queries, please, participants? Participants, audience can put your queries in the chat box. Sir, it was a beautiful, detailed, and current informative presentation. Thank you very much, sir, for your much initiatives and presentations. So, sir has said about the strains of virus, type of variants of interest, what is variants of interest, what is variants of concerns, what is variants of high concerns, what are the different terms in related to our current variants, different terms like what is immune escapes, type of vaccines, what is genomic surveillance, why we should be more conscious about the current variants of coronavirus. All about this is very beautiful and informative information. So thank you so much, sir. Participants, any queries?
There's one question.
Yes, sir.
Can we prevent mutation by exposing to any powerful radiance? We may not be, because the virus is inside the body. You cannot expose human beings to radiation. So it's not possible. You can expose the virus to radiation, but you cannot expose, because the virus is inside the body. Inside the body, this mutation is happening. It is not happening outside the body. It is inside the body. Anything else? If there is nothing else, thank you. Thank you very much. Thank you very much, madam.
Thank you, sir. Thank you so much.
Thank you very much, sir, for coming and enlightening our group in such a way. Thank you very much, sir. I welcome the Madam of Laurinima from this one. At the time of my presentation, I am unable to call you. Thank you very much, ma'am, for participating. I am very happy to see you in our forum. Thank you, ma'am, for coming in.
So next time. Next, I welcome our Haja Bibi ma'am for the presenting the topic of nurses burnout as frontline health workers during COVID-19 pandemic. Please. 1 second.
Vijay, not audible, Vijay. Vijay, not audible.
Madam, can you check
Yeah,
Yes,
it's
the
not.
ma'am.
audibility?
Yes, ma'am.
No.
I invite Dr.
Yeah.
Pro-Chancellor, Lincoln University College,
Vijay,
Malaysia.
Vijay,
Yes,
1 minute, Vijay. It's
Yes.
echoing. Too much of echo is there. Just check it. Ask Rashmi to check one more time. Echo is there.
Now it's okay, ma'am.
Now it's clear. Now it's clear.
Madam was the first Director of Nursing and Ministry of Health, Malaysia. Madam has also served as the Registrar of Nursing Board, Malaysia. Madam was instrumental in professionalized nursing profession from diploma to the degree level. Undoubtedly, Madam, her passion in nursing field has been continually transformed to Lincoln University College, Malaysia. Welcome you, ma'am, for present here. Yes, ma'am. Welcome you, ma'am.
Thank you very much. Can you hear me now?
Yes,
cannot hear.
ma'am. Yes, ma'am. I can hear.
Thank you very much. First of all, greeting from Lincoln University College, Malaysia. Especially, I would like to thank Dr. Indra and also, of course, Dr. Vijay Kumar for inviting me to speak on this webinar, and have to apologize because, but I'm sure Dr. Ramesh has done a good job on that. Anyway, and also I would like to congratulate you for this webinar and the second time around, especially during this challenging time. You know, it is a great initiative on your part to share of information globally. So very happy to be here today, and to be hearing some great talk, especially just now from Dr. Surya. It was very, very good, very detailed explanation on variants and corona and things like that. So actually, it has added, it's an added value to me. So this afternoon, actually, I'm speaking. Can I have my
Yes, ma'am. Yes, ma'am. You can
I
share.
have my
You can share your PPT, ma'am. Please share. Ma'am.
Can you allow?
Ma'am, just 2 minutes again, ma'am. There is some problem. Just few seconds, ma'am. Yes, ma'am. Now we can share, ma'am. Ma'am, please share your PPT, ma'am. Please share your PPT, ma'am. Ma'am, shall
Okay, hello.
yes, ma'am.
Um, just give me a minute. I just have to adjust my computer. Yeah. Okay. Actually, COVID-19, we have heard so much of it. Our country has suffered. All the countries in the world are suffering. So it's basically a public health pandemic, and it's a global crisis that actually affects every aspect of life, which has led to a very potentially devastating social, economic, and also political implication. So, this is what we are facing at the moment, everywhere in the world. And then, of course, Malaysia, we are managing here. I think everybody is doing the same thing. So actually, when we talk about nurses burnout and things like that, so, we look at actually, what are the healthcare challenges, that has in fact leading to all these things. So when you talk about COVID-19, of course, the morbidity is very high. Of course, mortality is very high. It's so bigger. The number is so big. It's very dynamic. In fact, in Malaysia, it is increasing by the day. And then you talk about it has affected the economic the country very, very badly. And of course, the workload to the not only to the nurses but almost to everybody, it has sort of changes. And those in the front line, of course, it has been increased. And we have to come out with SOP, a very good standard operating procedures, which actually is very reliable, which actually can, sort of meet the requirements of everyone, especially the public, to maintain the compliance. And we have to look at the healthcare risks, in terms of, like, for example, we need to have some proven healthcare measures, like social distancing, using of masks and things like that. And of course, we have to look at the vulnerable group, like the elderly, which has the risk. The risk is more because of the aggravating. It has aggravated the existing condition like diabetes and things like that, which actually can cause a lot of medical consequences. So all these, issues and happenings, of course, it can cause a lot of psychological issues and of course mental health issues. So those are the challenges that we are facing now everywhere in the world. Because my connection is quite poor. So, okay, because of that, we are all rushing to the, the time response. It varies, in terms of, the situation, in terms of where we are, in terms of, the number of healthcare workers around. So, the emergency handling processes itself cause so much of stress, especially when the patient arrives. And COVID-19 actually is sort of, even though we have been handling virus all this while, but it is a kind of virus which, has come out with so much of fear that even when the patient arrived there, it's already starting, our anxiety, what will happen next. And then your assessment, the process of all this, and of course the response to it. So these emergency handling processes, this thing actually has to be ready even before all this situation arise, so that we can handle it. So some of the health staff, maybe especially those junior ones, they're new, they just pass out, and then they're new to the workplace, and suddenly you have this situation. So, and then being thrown into an emergency situation, so they have to handle this process. So it started from there, what will happen when the patient arrives. How do you do the assessment? You need training for that extra thing, even though they are or have been exposed to infection control policy and things like that, but still they need to, still they need to strengthen and need to be oriented and need to be educated again. And of course, how do we respond to how quick is our response so that, to save life. So these are all the, some of the factors. So when you talk about that, okay, so what is stress? So when we say, we did a little study. So we said that, mild stress, we have moderate stress and severe stress. Mild stress, maybe you can handle for a while. It's about 44% in the society. And then, moderate is about 38.8, and then severe 17.2, which actually, at least a little bit better because, of course, the mild stress is there more. And if it is not going to be handled properly, of course, it will go into this stage of, and then leading to the severe. So when we talk about, how do handle this? So, we have a little study done also. They found out that female nurse having children more night shift and fear of infection is one of the causative determinant. And then this one has to be addressed, of course, but it has happened to this, group. Of course, there's less rest time. I can understand not many, not enough staff and things like that, and we have not prepared. We are not prepared in such a way that this thing happen. You don't have nothing because everything is an emergency. Everything has to be fast. You have to save life. So you don't have enough time. So that's the time. Sometimes you regret being a nurse. Why am I in this situation? So you try to think of all sorts of things, which actually causes a lot of attention in the mind. So this is one of those positive factor. And of course, lack of confidence in fighting the transmission, because we have read so much about it. The social media has put a lot of information. Sometimes it is informative, sometimes it is very fearful. Some, all sorts of information that you are so frightened that how are you going to fight? Are you in a position? Are you healthy enough? How do we do this? How do we fight this? So because you read also in the paper that even the health workers they are infected very badly. In one country, a lot of frontliners, doctors and nurses, the number, who passed away, because of COVID is very high. So all those things, it has imposed a lot of stress or a lot of thinking to the nurses, so that they feel that, do I have the confidence to fight this transmission? And of course, not having emergency protection training. I talk about emergency preparedness, because we are trying from nursing school, for example, we are handling the normal, situation. So when it comes to an emergency, a pandemic for that matter, and a very infectious one, so are they trained enough? So that is one of the issue that, the area that we have to look into as we nurse the patient, and we still have to keep on training and giving orientation. Sometimes something come out, and then how do we handle this, for example? And then of course, negative professional attitude. Sometimes the nurses becomes rude to the co-workers. The work ethic is less, maybe because of all these situations. So actually, when they start as a nurse, they are very nice, pleasant, very nice, and but then it becomes like this because of the situation. Okay. So when you talk about burnout syndrome, so with all those things, the issues that I've spoken just now. Okay. So there's a term, we call it emotional deprivation. Depletion, for example, you are deprived of emotion, you become like a robot, So because the nurse has to be responsive. One of the correct characteristics of nurse is responsiveness. When a patient calls for you, you have to go there and attend. And that is one of the the many good quality of how a nurse should be. We should be responsive. But in this situation, they become emotional deprivation. There's no emotion at all. Become detachment, very, very cynical, and sometimes very sarcastic, and sometimes they just want to be on themselves. So there's a low personal achievement because of all these things. They are not able to contribute. So when they are not able to contribute, you see, they feel that they are useless or things like that. So they sort of I am me. I'm just just detached from everybody. So this is the study done by the American Psychiatric Association, which I have just referred to. So this is what they find about a burnout syndrome, how it is, how it should be. I mean, how the nurse manifests, in burnout syndrome sort of. So I just, did one. I read one book. Maybe you know this, this guy in 2021. Look at India. So you have these 3% nurses have very high level of burnout. Not too bad. Nurses had high level of burnout also has, it's like there, and 14% nurses had moderate high level of burnout. So, it's like the high level, going very high level, very high is not too much, but high level is, is a little bit more than the very high level. And of course, the moderate is in between. So maybe we can still, treat ourselves, okay? Treat ourselves. So how is it in Malaysia? So in Malaysia, 53.8% of the healthcare workers are not related to personnel. It's more on personnel, yeah? Maybe because of the lack of ignorance, lack of personal training, social factor in the house and things like that. And 59.1% healthcare worker burnout related to work. Basically, over here, we are talking about the number of cases increasing by the day. And we are talking about shortage of health personnel, especially the nurses. And we are talking about lack of beds and also ICU beds and all those ventilators, oxygen, things like that. So these are all related to work. Okay, so it's about 39.9%. And then 17.4% is healthcare worker burnout related to patient. You see, more patient because during this time, the patient either can be demanding, either can be frightened. So, for the nurses to cope with this, especially when the nurses are not trained enough to handle patient like this. So, so their stress is sort of related to the patient. So this lady, she's done a study in 2021. So I thought that I just share with you how is it, the condition of Malaysia. So, when we talk about the pathogenesis of the burnout, okay, of course, there's a nurse so stressful with so much of factors, hitting her. We are talking about COVID-19 outbreak, a big pandemic affecting everyone. It has changes everybody. It has changes economic, we said just now, the social, everything, okay? So what about the workload? The workload, of course, it has increased. And then it's not only the impact of the workload. For example, occupational health hazard. Okay, the nurses will be standing. There'll be a physical pain and things like that. And of course, extraordinary precaution has to be taken. And then because of all these things, and of course the transmission anxiety. That is very important because everybody is very, very frightened of that. Because especially when you say, okay, you adhere to the SOP. And then you have to, comply to all these social distancing and all those rules and policy, to start the transmission. So, the anxiety is there. Whether is it enough for you? Have you done enough to protect yourself? So all this has, gone into of course, the job. It has become a stressful job. Now, when you go to work, you're supposed to be nursing a patient. Of course, a hospital is always a painful environment. But when we go there, we are supposed to allay fear. We are supposed to make the patient a little bit happy, a little bit confident in us. But, when you yourself are very stressful, you see. So that's why they said that, we have to take care of the nurses as much as we have to take care of the patient. Because if the nurses are not taken care of, or any front line of that matter, for example, doctors and any health workers, if you don't take care of them, I don't think they can be productive, to handle. So this led to low motivation in work. I've heard about, all this when we go around the hospital. So when you look at the patient all over, especially when they're all over the corridors, everywhere. So, the motivation to work is of course there. We're supposed to save life, but then, everybody is made up of many emotions. So during that time, maybe, of all these factors that has caused, that has led to the nurses being, having a low motivation, of course, the productivity is low. So of course, the loss in the interest in the job is there. It's extended to fatigue, and of course, job productivity is low. So it's all this, the burnout. It's not surprising. Okay, it's not surprising that after being exposed to all these conditions, the burnout will occur. Okay, So I just want to share you the pathogenesis of this, So again, the determinant factors, the SOP consequences. We are supposed to know the infection control policy, and yet we have many doctors, many nurses die because of this, in other countries we read about it. So what happened, the SOP consequences? Are they complying to it? Are they really, how did they comply? Okay, the fear of infection. Okay, because even with SOP you still get it, and then again because of that, there'll be a fear of infection, and of course the nurse workload plus economic issues. It has disrupted the household, for example, because your timing of going back is different already, and the way you handle the family is different because you're coming out from a very difficult situation. So this has led to physical and mental stress, and of course leading to a burnout syndrome. So these are the things that actually whoever is in the management level, we have to actually look at our staff, how best we can give the motivation in such a very painful situation, in such an abnormal condition. How best we can be resilient, and how best we can ensure that our nurses or our frontline workers are also resilient in such a situation. So I think that it has that has a very heavy responsibility. That is a responsibility of every manager or every leader who is actually looking after that hospital or after that health setup, to ensure that especially in terms of infrastructure, everything should be there. The PPE should be there, the SOP has to be complied, and the staffing should be, even though you don't have many, but can you give them a little break in between, and then how to create an environment in such a painful situation. So somehow or other, even though it's only for a few minutes, you have to allow the nurses to rest, for example, because as I said, they have to take care of themselves. We have to take care of them, then only they can take care of other people. So when I talk about fear of infection just now, of course, the COVID-19, from patient to nurse to family, the transmission rate is very high. In Malaysia, for example, the cases has gone up very, very rapidly. And we are so fearful, and then we're thinking, what next? Because you see, even if you're coming to my house now, I will make you to stand outside. Okay, I spray you first, with sanitizer, take off your feet, and then I spray your leg, I spray your shoes and things like that. And yet we are still, having all these cases going up. So we are just thinking how best, how best we have to look after ourselves. So of course we have to stay at home. You don't go out, right? And then of course somebody will be sending food to you, and then we have to look at those people who are sending food to you as well. So we have become so fearful of this infection. Even little thing we are so anxious whether this can be format, this can be a carrier for the COVID-19. So from the patient to the nurse to the family. So these are the the fear that we have at this point in time. So of course the risk factors in burnout, of course, they say that the younger age working in the hospital, because maybe especially those young nurses who just pass out, they don't expect that they're put in this situation, and then there's a low readiness to cope with COVID-19 outbreak, basically maybe because of ignorance of how to do it, because it is not so much in their curriculum. There is on infection control, there is on all these infectious disease and all that, but not so much on in emergency step. So we need to retrain them. So this outbreak, because it comes in so many, so many, morbidity is very high, mortality is very high. So the readiness to cope with this is very low, especially with that younger age. So of course, the longer working time in the quarantine area is also, especially when you are putting on an PPE, which is, I think, I'm sure some of you who has gone through it, what is the experience of going inside that PPE, and how best you can rest with that, how best you can take your food and things. How do you handle yourself in this situation? And then the heavy workload in the high risk environment is also a factor. And that can be said because we cannot help it. Now in Malaysia now, we are now asking all those retired nurses to come back to work, to come back to work, those who are healthy. Okay, but of course the retired have nurses in Malaysia, retiring age is 60. So you're 60, we say, oh, we are in the vulnerable group, and especially they are having underlying, sickness. They have diabetes, they have, all this hypertension, things like that. So they are not, they are not willing to go. They are not, except for those, healthy, which has kept themselves well until this age. So they don't mind going to, to work again to help in the situation because of the, to help in the heavy workload. So this is actually some of the things that we need to do. We have done in Malaysia. Of course, we have taken non-nursing or non-health, but those are just for counseling, not so much on, caring for the patient per se. The nursing care, of course, it cannot be done, if they are not nurses, except for the caregiver. The specific non-nursing thing can be given by anyone who has, it's like a caregiver job. Okay, so we have to look at things like that to address the heavy workload, especially in the high-risk environment. Yeah, but most of the high-risk environment was in the hospital, in the ICU. So people has to be trained actually for this situation. Okay, and then without specialized training about COVID-19, of course, nobody has the confidence to handle. Nobody, even a trained nurse without specific training for the COVID-19 to know the pathogenesis of it, to know what Dr. Surya has actually about the Variance and things like that, to know about all these things. If if we are lack of knowledge, of course we don't have the confidence, to do that. And of course the risk factor is one of the risk factors for burnout, because if I'm being put in a situation where I cannot even handle it properly, I think it will cause me to be very, very anxious and to be very worried. And of course we need to do the training. So in an emergency situation, you need to put nurses, and at the same time, you need to keep on retraining, re-educating, and whatever you read, what has WHO come out, what has the country policy come out, and what has the hospital policy come out, and how do you disseminate this information to the existing staff, every day, to ensure that they are updated and they know what they're doing. So that is our job, especially to prevent the burnout. So some of the behavior-related burnout. Look at this: feeling very stressful, very tired, extended fatigue. You can see that. Actually, this is a little picture of some of the hospital. So these are some of the it is very common in the situation. But still we need to address this. How do you address this? Because we do not want all our staff to be like this. So how do we sort of decrease this sort of situation in a situation like this? So when we talk about the detrimental burnout, so this is how it is. Personal health, is not there anymore because you don't take care of yourself. The productivity, it has affected the productivity, and of course the institutional, it has affected the institution, the hospital, and in terms of business, it's quite bad. So these are some of the the related sort of what it will become. And how do you control burnout? How do we control this? As I said, burnout management, which is a systematic problem, and an individual, which can lead to an individual response. If the system is not right, of course, the response of the individual is not right as well. Okay, so we look at the organizational-based interventions. Have we, for example, in terms of infrastructure, we need to ensure that everything is there. Yeah, the environment has to be a little right, of course, because as I'm saying this, I'm talking about the ideal situation. And you will be saying, oh, you do not know how the situation is. Of course, we know. But then how best we can make it more compatible, a little more compatible. Say in terms of organization, you see, infrastructure, at least there must be a chilling out space or a little, room for the staff to rest, because as I said, we need to take care of them. So number one. Number two, we have to arrange, I'm talking about management. You have to arrange in such a way that even though you have not enough staff, how do you break them out so that they can rest in between? So the timetable, your work timing, your work time, how do you have to break? Is it long 8 hours or is it 4 hours? Because of the situation like this. So we need to have these adequate measures to get everything ready. And then in terms of the training of the health care workers or the frontliners, especially in emergency preparedness, so I think it's better to have them ready so that in case there is a crisis occur, the coping method is better. They can cope well, and they will decrease adverse consequences. Okay, and then in terms of nurses, you have to take care of yourself. Okay, you have to take care of yourself, and you have to, you have to learn, how is the coping mechanism. Because you see, when you go for nursing, you know that you are handling many type of patients. Okay? It's not sick, in the sense that they ask for counseling, so they become a patient. So how do you handle that? You have a patient who are sick, and how do you handle that one? So it has already been taught in a school, in a curriculum. How do you handle all these patients? They call it difficult patient, good patient, also patient. Okay, we are the one who turn them up. There to meet everybody's patient. So it's already there. You are already made how to be handling this, in this situation. How sure that you are resilient enough. So first thing, look at yourself. Confidence to handle this. Okay, number one. You have to ensure that this is a very comfortable situation for the patient and also for you, right? So that you try to understand the situation, you try to understand the situation of the management of the hospital, so that because you do not want to be suspicious and say, why are they treating us like that? We don't want that sort of question. So you need to understand how is the management's thinking, so that you are part of the thinking. You have that ownership, and then when you have that ownership, you don't have that, this suspicious mind. You don't have that feel that, oh, I'm not going to cooperate. You don't have all those things. Because the moment you understand the situation, then only with the management, then only you can together help to solve this problem. And that is very important. And when you are in that situation, you don't have that stress of, all these things, but your stress is more on how do I improve the situation? And that sort of stress actually is more on positivity, because, it's like it gives you the stimulant. Okay, how do I improve this situation? We are in a very stressful situation with all these conditions, but how do we improve the situation? So you look management, and that is very important, so that you don't complain. You don't complain unnecessarily. If there's not enough PPE, how do we do about it? There was a time the director of the hospital of one of the biggest hospital in Malaysia, you see, the director is cutting material to make PPE, because there was a time that we ran out of it. So she was cutting in the laundry, give the staff to just put on, even with plastic, you put on your leg and tie. That sort of improvising to prevent the infection. So you see, so all the staff also together with them. So there was a sense of belongingness. How do we ensure that this hospital can cope with the situation? And you have to be part of it. So this is how you control your burnout. Otherwise, it will be like I am here, it's like an island, and you are there. So if you are not jiving together, you are not working as a team, and that is that will lead to a very adverse consequences, that will lead to a very high stress, and of course it will lead to a burnout. And especially when you're in hospital with patient and all that, your productivity is very low, and that is not very good for hospital. Not very good for hospital to perform, to give services to the population. So in a nutshell, I would like to say that the management has to really look after the nurses to ensure that infrastructure wise it is there for them, and in terms of emotional support, you be there. For example, if I am in charge of this this ward, for example, I have to be by example. I have to be there. I have to also look at everything, and I have to know what's going on. Okay, and I have to ensure that they also know that I can help them, how best we can help each other. Okay, so and then in terms of training, you have to ensure you yourself know whether you know or not. You need to read, you need to attend a webinar like this, and then you need to have all this ongoing training and maintain the SOP. I think with all these things, we I think to a certain extent, even though we are in a very, painful situation, a very challenging situation, I think, with all this teamwork and attitude, and attitude of professionalism, teamwork, and a caring attitude, I think we can together, cope this burnout among the nurses in the hospital. So that's about it, my dear. So if anything, I just want to give you a little hard share because I'm sure all of you know this subject very well. So I thought I just, share with you all.
Thank you, ma'am. So thank you, ma'am. How we, the nurses, have to plan ourselves to work in this current pandemic to overcome and control over our burnout towards this current pandemic situation. So what's burnout, how to take care, how to tackle as we ourselves plan to do the overcoming burnout. So thank you so much, ma'am, for your wonderful presentation. Participants, is there any queries? Can put it into chat box. I think no questions, ma'am. So thank you. Thank you. So thank you, ma'am. And thank you once again. We are going to we'll take a short break. After 10 minutes, we'll take a short break. We'll start the session after 10 minutes.
Thank you very much.
Thank you. Welcome back to the session. Now we will have the session on paternal role on pregnancy with COVID-19. To present over this topic, I invite Mrs. G. Aruna, Assistant Professor, Narayana College of Nursing, Nellore. Mrs. Aruna, she is a skilled and qualified nursing personnel. She is going to pursue PhD in nursing under Lincoln University College, Malaysia. With this, she is having 8 years of teaching experience for all the program of nursing, and she's had the capacity to have developed the students in implementing and developing educational tools and technologies in colleges, in classrooms. So welcome you, Aruna, to present a topic over here. Yes, Aruna, can share your PPT. Please unmute yourself. Aruna, please unmute and talk.
Thank you, Richi ma'am. Good morning, everyone, and dignitaries, resource persons, our principal ma'am, Dr. Indira S., and our HOD of Professor V. Jayanti ma'am, all HODs and my dear colleagues and students. First of all, I need to say thanks to our principal ma'am, Dr. Indira S., for giving me this opportunity. Thank you, ma'am. So my topic is paternal role on pregnancy with COVID-19. Getting the child is one of the best wishes of many couples. When the woman gets pregnant, partner to take the utmost care of her. Yes, husband has to take the care and woman needs to take extreme care of her. Woman, because the pregnant woman undergo a lot of changes during the pregnancy time. That is physiological, psychological and hormonal changes is there. So these are all the changes will be occurring during the pregnancy, and making wife happy during this period is the best services or gift to the partner. When it is woman is happy, she can have a peaceful mind and good heart with that in term help in baby growth. So but this in pandemic situation increased stress, fear and anxiety, loneliness because of this quarantine. This chronic stress will be can contribute to the health issues. So what all the issues will be happening? What is the role of a partner? We'll see. So according to the ICMR, Indian Council of Medical Research, pregnant women have been infected during the first wave from March 2020 to January 31, 2021. The first wave is started and completed at January 31st, 2021. And the second wave is started February 1st, 2021 to ended with the May 14, 2021. According to the ICMR statistics, it has been found that during the first wave of 162 weeks, 14% women out of the 1,143 have been affected with the corona. The pregnant mothers is affected with corona, whereas in the second wave, 111 out of 387 pregnant mothers is affected with the corona in second wave. So ICMR said that 2% means mothers is going to die after the delivery. During the first and second wave, 30 out of 1,530 mother dies due to the infection, and 28 deaths is occurred due to increased level of the infection in the lungs and failure of the respiratory system. Because of the failure of the respiratory system, 28 deaths is occurring according to the ICMR statistics. And coming to the WHO, it said that World Health Organization, more than the 2 million people is pregnant mothers is affected with this infection, and 1,90,000 deaths is occurred in April 26. So coming to the standard recommendations, some of the agencies given some recommendations and guidelines. That recommendations are adopted based on the guidelines from international agencies like ICMR, National Health Mission, the World Health Organization. So like this, so many of the agencies given some guidelines. Why? Because these are all simplified and made user friendly for Indian context. This guidance is prepared consider resources in our government health settings. So what are the guidelines or the recommendations? We'll see. So you need to be remember clearly see the points, that is effect of COVID-19 on pregnancy and effect of COVID-19 on the fetus. What all the effects will be occurring because of the COVID-19 during the pregnancy and to the fetus, and how to go for antenatal checkups during the pandemic time, and pregnancy care of the COVID-19 suspected cases and the confirmed cases, how to take care of the mother, and during the intrapartum period, what type of care has to provide, and during the postnatal period, what type of the care has to provide. We'll see one by one. Coming to the effect of COVID-19 on pregnancy, if comparing to the general population, pregnant women do not appear more likely to contact with this COVID infection. If you are seeing some of the reported cases, some of the mothers is affected with the COVID-19, that is pneumonia in pregnancy, and these symptoms is mild. So they will be recovering easily. Mild symptoms, no, so they are easily going to recover. In other types of coronavirus infections like a severe acute respiratory syndrome, Middle East respiratory syndrome, this in that type of the viral infections, mother is more prone to get the infection. High risk will be there, and this high risk will be happening in the third trimester. Third trimester means 7 to 9 months. During the 7 to 9 months of the pregnancy time, the mother may get the complications. And in these cases, reports of the preterm birth in women with the COVID-19. So preterm babies or the IUGR babies will be occurring, and sometimes the mother may or the newborn babies will be going to die. Stillbirths will be occurring because of this severe acute respiratory syndrome, Middle East respiratory syndrome. And on account of this lockdown situation, the mothers will be isolated. So they will be isolated and in quarantine. So they are getting the anxiety, fear, depression. So with that, domestic violence is also may be increasing, and pregnant. So in this situation, the pregnant may require additional mental health support. So the partner or the husband has to give the mentally, physically, psychological support has to be provided. I told you this will be mild cases will be mild symptoms will be there during the pneumonia period, and if the mother is having comorbid diseases like heart diseases, diabetes, hypertension, asthma, or immunocompromised diseases like HIV, systemic lupus erythematosus, in these conditions, the mother may getting complications. So increasing the complications like asphyxia, premature rupture of the membranes. Sometimes the mortality and morbidity rate also will be going to increase. And routes of the transmission. So here the routes of the transmission, available information suggests that infection will be a originally zoonotic process. Still the current transmission, the infection will be getting from the person to person. So the respiratory droplets will be through the airborne or through direct contact with the door handles, glass cups, cell phones, like that. With that, contaminated surfaces, infected secretions and all will be there. Through the direct, the infection will be spreading one person to another person, and transmission could also occur through the infection with the feces, but the propagation throughout this route is much relevant. So mainly person to person and contaminated surfaces. With that, the infection will be spreading one to one person. And pregnant women are vulnerable to respiratory pathogens due to the immunomodulatory situation and physiological adaptation. So because of this respiratory pathogens, the organism will be entering into the lungs and maternal pneumonia is accompanied. So with that, some of the complications will be arising. So asphyxia or the hypoxia will be occurring to the mother, breathing problem will be arising. So with that complications, preterm or the premature rupture of the membranes, placental abruptions will be occurring, or sometimes preterm labor leading to, with this all the complications, fetal or the maternal death will be occurring. So reducing of the respiratory volume, the diaphragm elevation. So edema will be occurring, edema of the respiratory tract mucosa. These alteration increase the tolerance of women hypoxia. So the woman will be getting the hypoxia because of the reducing of the respiratory volume due to the diaphragmatic elevation, and moreover hyperinflammation also will be occurring. Why? Because due to the enhance the levels of the cytokinins. Here the high levels of the cytokinins, that is interleukins, cytokinins interleukins 6 and 12. This will be associated with the multi-organ dysfunction. So when raising of the cytokines, multi-organ dysfunction will be occur, wherein means severe cases of the pneumonia or critically ill patients who are admitted in ICU, those pregnant mothers will be getting the hyperinflammation. And when increasing these levels of ACE inhibitors, the kidney, because of the overexpression and production of the angiotensins. So these ACE inhibitors will be increasing, and it will be producing the angiotensins 1 to 7. It will be increased. With this, risk of the acute infection of the kidneys or acute kidney diseases will be occurring in severe acute respiratory syndrome, that when the mother is getting positive or severe cases. And activation of the coagulation pathways. So coagulation pathways, what will be happening means, due to the cytokine stroke, hyperinflammation can lead to the local systemic coagulation. Abnormalities will be affecting, and with that severe, several organs will be going to damage. Therefore, need to monitoring D-dimers and fibrinogen levels. So with that, thrombolytic abnormalities will be occurring. With these complications, here maternal consequence will be occurring. Sometimes this mother may get the asymptomatic or some of the general symptoms like cough, fever, and breathing problem will be occurring, pneumonia. So I told before itself, the multi-organ dysfunction will be there, thrombotic abnormalities. With that, preterm labor or premature rupture of the membranes will be occurring. So when these are all, with these maternal consequences and all, placental abnormalities also will be occurring because of these alterations, chorioamnionitis, thrombi in the fetal vessels, malpresentations or the malperfusion, and maternal vascular perfusion, and residual arteriopathy, chorioangioma, multifocal infections will be occurring. So with that, mother may going to die, as well as the fetus also going to die. And fetal and neonatal consequence, prematurity. Before itself, without completion of the gestational weeks, premature baby or the fetal distress, stillbirth will be occurring, other small for gestational age, low birth weight babies will be occurring, and reducing of the fetal movements because of the vertical transmission. But this vertical transmission with regard to emerging evidence now suggests that vertical transmission is probable, although the proportion of the pregnancies affected and significance to the neonate, this has yet to be determined. So, but till this, if we are seeing all the records, there are no records cases of vaginal secretions being tested positive for COVID-19, and at present there are no recorded cases for breast milk being tested for positive for COVID-19. So the vertical transmission will not occur. So the baby will be safe. I told you no data suggesting that increasing the risk of miscarriage or the early pregnancy loss, and there is no evidence currently to teratogenicity and current not yet indication for the medical termination. So there is no evidence for getting of termination of the pregnancy or change in the antenatal care. Previously, what are the guidelines and protocol we are following, same we can follow, and mode of the delivery and postnatal care also will be a same guidelines and protocol we can follow according to the NHM and ICM of WHO. And coming to the symptoms, in initial studies, the evaluation of the infected pregnant women with the SARS-CoV-2 manifestations of the general symptoms of COVID-19, fever, cough, sore throat, myalgia, diarrhea, malaise, and sore throat of shortness of the breath. So these are all the symptoms. These are all the mild symptoms. If the mother will be getting the COVID positive, mild symptoms will be occurring: fever, cough, sore throat, myalgia, diarrhea, malaise, and shortness of the breath. So clinical presentation remains same of the general population. As usual, how the same population, general population, how they are following the incubation period 5 to 7 days. The same way the pregnant woman also can take the precautions under self-quarantine 5 to 7 days. And typical symptoms will be fever more than 38 degrees Celsius and 100.4 degrees Fahrenheit, any one or more of the so here not only the fever, dry cough, sore throat, difficult breathing, shortness of the breath, and some of the gastrointestinal symptoms also will be we can observe. If you are going to the laboratory test and all, so what are the investigations we can do means leukopenia, lymphocytopenia, mild thrombocytopenia, mild elevation of the liver enzymes. Because why we need to go for the liver enzymes, and that means kidney damages will be there, and cytokine interleukins will be increasing, thrombocytopenia will be occurring. So for that we need to go for these investigations and radio imaging with the abdominal examination. Why? Because of the fetal condition, to know the fetal condition or any abnormalities will be occurring or not. To know that, we need to go for the ultrasonography and radio imaging examination. So coming to the treatment, the pregnant woman, as usual, the general population, how they are in a quarantine, the same way 14 days, the pregnant woman also has to be in quarantine. If the case is confirmed positive will be confirmed, then clinical examination we need to go. That is the RT-PCR test, nasopharyngeal and pharyngeal samples need to be collected. If the mother is having the asymptomatic, no isolate, there is no need for isolation, but we need to be monitored at home. That is the respiratory symptoms, any shortness of the breath, fever, dry cough, sore throat, like that we need to be assessed and monitoring. If negative, stop monitoring. If the positive case means we need to be isolate the mother at home for 14 days. And if the mother is going to deliver the in home itself, we can call from the sub centers or the community health centers, ASHA workers or the team members, we need to be called and get the delivery. And breastfeeding as per the guidelines can give, and mother should be isolated from the newborn until the symptoms will be a shedding clears, the mother should be in a quarantine. And then if the mother is having the symptoms like a fever, respiratory symptoms of the shortness of the breathing problems, and sore throat, like that, symptoms will be there, means we need to be monitoring and we need to be admit into the hospital. So isolated room prefer with the negative pressure, we need to be provide and protect the mother, and then we protect care for the visitors and the health personals. Delivery and neonatal processes, equipment and all has to keep ready. And then if the negative, if the results will come negative, isolate at the home 14 days, and we need to be monitor the respiratory symptoms. If any symptoms persist, the mother has to take the retest. Then if negative will comes, we can leave it. And if the positive, the mother may get positive, need to be isolated. If severe symptoms will be there, isolated. And here we need to be monitor the temperature, heart rate, blood pressure, respiratory rate, and just imagine we need to go for the CT scan. And as well as we need to be monitor the fetal heart sounds, and for fetal heart sounds need to be monitored, and fetal maturation. So if the mother is below 34 to 37 weeks of the gestational age, and depending on the maternal status, maternal condition, we need to be administer the betamethasone injection to improve the fetus lung mature. Then IV antibiotics has to be administered, that is depending upon the patient condition, and what are the antibiotics is using according to the WHO, that has to be administer antibiotics, and betamethasone has to be administered to improve the lung maturity. And if any symptoms will be increased, then the mother has to be transferred into the intensive care unit. Then there need to be monitored hourly respiratory rate, systolic blood pressure, and Glasgow Coma conscious scale has to be observed. If then after that, along with that, fetal heart sounds and growth rate and Doppler, everything will need to be monitor fetal heart rate, and then fetal movements has to be a check, and severe failure is the, and if severe failure will be there, severe failure criteria will be there, means need to go for cesarean section. And normal, if the mother is calm and asymptomatic, like that, it will be there, means need to go for normal delivery. That is, if the before 24 weeks of the gestational age, if severe maternal illness, consider maternal termination of the pregnancy. So this has to go in a legal way. But most of the cases, there is no termination of the pregnancy. Then after the completion of the 24 weeks of the gestation, we need to be see the vaginal delivery, that is induction of the labor, or instrumental like a forceps or the venous delivery we can do. And when possible, unless severe failure will be there, means any severe complications will be occurring, means need to go for the instrumental delivery. And early clamping of umbilical cord and cleaning of the newborn baby, newborn resuscitation has to do, and newborn monitoring. And for the newborn baby also, we need to go for the RT-PCR test, and then breastfeeding with the precautions and considerations. The mother can give the breastfeed with the precautions, and mother has to be isolated from the newborn until the viral is died or the shedding. Then she can isolate. After that, mother has to be in rooming in, or mother can discharge from the hospital. This is the management schematic presentation. So during the antenatal period, the partner has to give some of the care or the advices during the antenatal period. So what are the care he need to be given, means if the during the first trimester or the confirmation of the pregnancy, the mother may got affected with the COVID, means partner has to be advised to take to the routine antenatal examinations, So this when she affected with the corona, he has to call through the telephone, or the regular ASHA workers and the team members will coming and visiting with the PPA. So with the confirmation of the pregnancy at 7 weeks, she need to be registered and ensure that it's neither molar or the ectopic pregnancy, or when the due date will come. So everything has to be ensured. And second visit 13 to 14 weeks, in this period also, at this visit she need to go for the ultrasound examinations when the symptoms will be reside. After that she need to be go, and 18 to 20 weeks and 34 weeks as usual she need to be evaluate the fetal weight and size and placental positions. Any malpresentations at the positions will be there, or any abnormalities is there need to be identified or evaluate, and check for multiple fetuses, either the multiple pregnancy or the single pregnancy need to be checked, and assess possible risk to the mother and determine the due date unless they meet current self-isolation criteria. So these are all the antenatal visits has to follow. Minimum 8 visits is necessary. First 7 weeks and 13 to 14 weeks, second visit 18 to 20 weeks, third visit 34 weeks, fourth visit. After that, weekly has to be a visit. From the 34 to 38 weeks of the gestational age, weekly the mother has to be a visit. If mother is asymptomatic or the COVID negative, normal mother, healthy mother means. So like this, the mother has to be a visit. And so for women who had symptoms, appointments can be deferred until 7 days after the start of the symptoms, unless the symptoms will be persist. She has to be a quarantine, and she need to be check the kick count, fetal kick movements. Means that is the fetal movements. She need to be checked from the morning to evening 9 to 9 a.m. How many times the fetal kick to the mother abdomen. So that movements has to be a count, fetal kick count to be a maintained. With that, we can came to know the fetus is healthy, or the thing we can came to know regarding the fetus. And if needed, to visit the health center. If any problem will be arising, the partner has to be a call 108, or he can transport with the own vehicle and informing the ambulance staff about her status. The partner has to be informed to the staff members. And for women who are self-quarantined because of someone in their household or has possible symptoms of the COVID-19, she should, or the partner has to take the appointments, should be deferred for 40 days. And any woman who has a routine appointment delayed for more than 3 weeks, if any symptoms will be appears, delay the appointment 3 weeks. If any ANMs or the ASHA workers can contact through the telephone or the routine household visits with the PPA, she can take the appointment, and she can take care, and she can know the health status of the fetus and the mother, or otherwise she can delay for the appointment for 3 weeks. Even if a woman has previously tested negative for COVID-19, if she present with symptoms, again she has to go for the testing. It may suspected positive, so that's what she has to go for the test. And referral to antenatal ultrasound services for fetal growth. So they need to be the mother or the partner has to be a referral for antenatal ultrasound services for growth surveillance is recommended after 14 days following the resolution or reducing of the symptoms of COVID. So warning signs during the pregnancy, what the partner has to do means the partner has to check mother may having any headache or blurred vision, chest pain, or the heartbeat will be raising. So these are all the warning signs the partner has to know, and we need to be educated. And then baby movements will be there or not through the phone itself, or the by asking mother may make quarantine, So through the phone itself, the partner has to be asked baby movements, are the any stopping, are the slow movements will be there, are the chest pain will be there, heartbeat will be raised, are blurred vision, headache, and swelling or redness of the edema, or the leg pains will be there, cramp like leg pains will be there or not, and then dizziness or the fainting, fever is increased, then abdominal pain, then vaginal bleeding or the leaking will be there or not, and extreme swelling of the face, legs, and hands. This and all has to be no warning signs and all the partner has to know, and then trouble breathing, any shortness of the breathing will be there, nausea and vomiting, morning sickness will be there, vaginal bleeding, and tiredness, overwhelming, or the tiredness will be there. So these are all the warning signs the partner has to know, and he has to be asked to the mother. These are all the problems, anything will be there. Means please inform like that. He has to give the motivation or the encouragement. And anticipated problems. For that, what are the management, what he has to do, what is the role of the partner, means when the nausea, so these are all the complications, nausea and vomiting and backache, then constipation, leg cramps, acidity at the heartburn, breast tenderness, hemorrhoids. So some of the problems will be arising during the pregnancy time. So for that, home remedies are the any precautions will be there or not according to the symptoms, what treatment has to take, the father has to or the partner has to know. This nausea and vomiting will be occurring more in the primary gravida, less in multipara mother. So here why this nausea and vomiting will be occurring means because of the increasing of the human chorionic gonadotropin hormone. With that, nausea and vomiting will be occurring to the mother. So this is no harm to the fetus and mother. So generally it will be a first trimester only this will be occur, nausea and vomiting. After that this will be a subside. And what she has to take, what diet she has to take means avoid the oily or the spicy food, and she has to take the meals frequently she need to take, which small frequent meals she has to take, and fresh fruits, vegetables like that she has to take, and home remedies. Morning when she will wake up from the bed, ginger and lemon tea or the warm water, like that she need to be take, and medications. If the high vomitings will be increasing more per day, more 5 or 6 times it will be occurring, means need to take the pyridoxine twice daily, and if severe cases need to be administered the metoclopramide. So these remedies and all asymptomatic other symptomatic person can follow. And heartburn. So this heartburn also because of the progesterone hormone, heartburn will be occurring to the mother during pregnancy. So this will be reducing the tone of the lower esophageal sphincter. So with that, heartburn will be occurring to the mother. And diet modifications, so reducing of the spicy food and eat small frequent meals and short intervals she need to be take, and posture modifications. So avoiding bending and lying down immediately after taking the meals. So should not bending immediately and should not lie down immediately after taking the meals or the breakfast. She has to walk or she has to sit. And medications, receptor blockers like a ranitidine, antacids she can take to reducing of the esophageal sphincter. So antacids she can take like a gel. And one next complication is the minor complication, that is constipation. This is also because of the progesterone relaxes the musculatures. So with that, motility will not occur, bowel movements will not occur. So motility of the smooth muscles, reducing of the movements of the smooth muscles. With that, constipation will be occurring. So diet modification, what the mother has to do means she has to take the high fiber diet, and plenty of water she need to take, and more fruits and vegetables has to take. Okay, and what medications? Mild laxatives like a lactulose, herbalax, or liquid paraffin medications she can take to relieve from the constipation. And next minor complication is the vaginal discharge. This is because of the vascular congestion or increase the activity of the cervical mucus secreting glands. Vaginal discharge, white discharge will be occurring. So far, there is no treatment is required, and we need to check the vaginal discharge color, the color, and any foul smelling is there, or the pruritus will be there, any inflammation will be there or infection will be there or not, we need to be checked. And when passing the urine, burning, maturation or the painful is there or not has to be identified. So above these signs indicate infection, in which case the same will have to be treated according to that. So here this is no that much effect will not there. It will be reduced first, it will be occurring in the first trimester and the last trimester because of the vascular congestion and increase the activity of the cervical mucus secretions. So here the glands will be secreting more, secreting the cervical mucus secretions. With that, vaginal discharge will be occurring. So for this, the mother cannot afraid. Our next minor element complication, backache. So this is due to the pelvic organ condition. So day by day the uterus will be increasing, the baby will be growing. So pelvic organ congestion are the lateral due to the strained pelvic supports are the exact lumbar lordosis. So for that back pain will be occurring. So for that what the mother has to do is she has to, when she is sitting, she has to take the support, and she back massage has to do, other heart fermentation can do, and drugs. If severe back pain is there, she has to take the mild analgesics, or otherwise she can change the positions and walking ambulation will be there, means the back pain will be reduced. And hemorrhoids and varicose veins. This also due to the vascular congestion and increasing of the progesterone levels, hemorrhoids and the varicose vein will be occurring. For this, during the pregnancy time, no need to take any treatment. It will be relieved after the delivery of the baby, and avoid that constipation. So for that avoiding of the constipation, the mother may has to take more fiber diet and plenty of the water, and elevation of the legs. Okay, she need to be elevated when she is taking rest, and she should be avoid the prolonged standing and sitting, and compression of the stocking. She can use the socks compression stockings. She can use, and medications, laxatives, and the creams are hydroid cream she can use for reducing of the hemorrhoids. And advices for the mother. So what are the advices will be there, means when she is having any symptoms, she is in quarantine, self-quarantine will be there, means disinfectant on surface to reduce the vomits. So with this we can reducing the spread of infection. So disinfections of surfaces to reduce the vomits. And for women working outside the house, it is preferable to take work from the home. So she should not come into the outside. Keeping when she is talking with the partner or with the family members, she need to be maintain the distance at least 1 to 2 meters distance. She need to be follow, and the necessary interactions has to follow, and avoid the non-essential travels. If she need emergency to travel, means she can prefer home vehicle or the private vehicle. If any in journey any jerks will be there, means better to avoid, especially in the first trimester and the last trimester, the travel should avoid. And avoid gathering the functions like a ceremonies, pregnant ceremonies, that and all milestones, and all she can what are all the cultural practices will be there, that she can avoid. And minimize the visitors from coming to meet the mother, and newborn after the delivery. So minimize the visitors to meet the mother or the newborn baby. And some of the advices during the pregnancy, regularly she need to go for the blood test, blood checkups, has to go HB levels and urine levels, and she should be a visit to the doctor, and she has to do the easy normal exercises, yoga, deep breathing exercises, and she should take the vitamin supplementation, that is the B12, iron and folic acid, zinc, magnesium. And so like that, vitamins and iron supplementations has to take, and then need to be check the weight. So weight gain will be a first trimester 1 kilo will be increased, and second and third trimester each 5 kgs will be increasing. Uh, Normal weight gain during the pregnancy time is 12 kilos. If it will be increased, the mother may monitor, check the blood pressure, and then deep blood pressure, and the may cause to hypertension. So with that, the mother may check the weight, and she has to take the proper diet, and she need to be take the sleep. The partner or the father has to give the advices to the mother. And the father has to and to reducing the maternal stress and the mental health. So she should be take the self-care and social support, step care and system integration. Smartphone enabled services will be there. So they, along with that, the partner has to give the guidance and counseling to the mother regarding the reducing of the stress, and she has to go for the small walking and deep breathing exercises. Like that, he need to be give the guidance and counseling to the mother. And to improve the mental well-being, she has to take more nutrients, that is vitamin B6 and vitamins, that is vitamin B12. So where we will be getting this vitamin B12 means fish, beef, milk, egg, chicken, and fortified nutritional yeast. And magnesium, cashew nuts, pumpkin seeds, then cocoa beans, leafy greens, antioxidants like beans, soya, fruits, nuts, and veggies, and she can take essential fatty acids like a salmonella, fish, nuts, seeds, and probiotics, yogurt, pickled vegetables. So these are all the things has to be provide to the mother. So the partner has to be provide all these supplementations, and he has to give the guidance and support to the mother to improve their to improve their mental health and physical health. And he has to take care of the mother during the pregnancy time. Dental care is necessary. He has to tell to the mother or motivate to mother, do the brush 2 times twice daily, and regular bowel movements may be facilitated by regulation of the diet and taking of the plenty of fluids and vegetables and milk. And he has to educate to the mother regarding avoid the high heel shoes. So this will be uh, giving the mother imbalance. Okay, center of the balance will be altered. So wear loose garments and comfortable garments she has to be use. So next coming to the weight gain, already I told weight gain has to check in each trimesters, and then rest and sleep. During the daytime, at least 2 hours she has to sleep, and night times 8 hours she has to sleep. So the partner has to check whether the mother is taking rest or not. And he has to encourage to take the naps during the daytime. And if the mother is isolated and the quarantined, uh, he has to encourage to go for the small walks or the exercises. And then in front of the mother, should not smoke, and alcoholism should not do, the father should not do, and care of the breast when she is taking bath time, and avoiding of the travel. So these are all the during the pregnancy time, the partner has to give the advices to the mother. And then next coming to the intrapartum period. Intrapartum period, when the mother is having any symptomatic other symptomatic symptoms will be present, means she will be isolated room, and full maternal and fetal assessment should be conducted. So there, according to the severity, severity and any symptoms, shortness of the breath, like that it will be happening, means so follow the multidisciplinary team approaches. What the team members is telling, that the partner has to teach to the mother, and ensure the safe institutional delivery. If symptoms will be severe, he has to take into the institutional delivery, and delivery should be preferably at the tertiary care centers. So there, in institutional delivery will be happening after the admission of the hospital. The maternal observations, including the temperature, respiratory rate, and oxygen saturation, here need to be monitored the temperature hourly, respiratory rate, and oxygen saturation, and confirmation of the onset of labor as per the standard care. So here need to be the father has to be know on when the delivery will be occurring, and what is the mother condition, that he has to be and electronic fetal monitoring, that will be a hourly oxygen saturation during the labor time, and through the cardiotocography fetal monitoring should be assessed. And then each pregnant woman to be linked to appropriate health facility for the delivery by the ANMs at the community health centers or the PHC centers. So the team members has to be has what the team members will be giving the instructions, that the partner has to be follow for safe delivery. If any strict monitoring, if the mother is having severe symptoms will be there, monitoring of the maternal and fetal well-being with the partograph, and periodically has to be assess the respiratory status, whether the shortness of the breath or the difficult breath will be there or not, need to be identified and monitor. And oxygen saturation, this oxygen saturation need to be monitored through the pulse oximeter. This also hourly once has to be checked and examined. Should not below 94 will be there, means the mother may in a critical position. So prolonged labor should be avoided. Early decision for the C-section. So the partner has to take the early decision for delivery of the cesarean section. So in case prolonged labor, indications for the intervention should follow. What normally the obstetricians following the standard practices, that they has to follow during the intranatal period. And he has to do the all paperwork and encouragement through the phone, and all he has to complete. And then the father has to give the general guidance or the general support to the mother when he is in a symptomatic position. So inform the consent in addition to routine consent he has to take, and it would be prudent to include the aspects related to the COVID-19 infection for the time of the pandemic. So during the pandemic situation, he cannot meet to the mother, so he has to do the phone, he has to give the encouragement and support physically and psychologically. He has to give the support to the mother. And the points that should be included are the probable chances of COVID-19 infection while in the hospital and its consequences. Some of the precautions they has to follow. Why? Because to avoid the infection. After that, preparation of the mother for delivery at the third trimester. If the symptoms will be reduced and the mother will be healthy, so that time they has to plan for the birth. So when the mother has to deliver and the date has to be decided, and prepare mother emotionally, and they has to work together for delivering process, and talk about what all the worries will be happening during the delivery time, or after the delivery what all the problems will be arising. If the mother will be in quarantine, through the phone or through the phone, he has to talk and he has to give the advices to the mother, and he has to give the support to the mother by smile and supporting to one another. Means both together has to support during the third trimester. And the partner has to be keep ready for money for delivering process and all, and what are the materials is necessary, clothes for the mother and baby, clothes, what are the clothes is necessary, that has to be keep ready, and the family members has to keep ready. If the mother is reducing of the symptoms, asymptomatic, other negative case will be the means, so that time he has to be keep ready everything. And then consider hiring a doula. So this doula is nothing but pain relief techniques, that is massages. They can go for the consider doing of the massages, back massages, like that they can go, and psychological support to the mother, to the partner. And the father has to know what are the warning signs will be there during the labor period. So labor lasting longer than 12 hours. So the labor process under first to third stage, it will be from the delivering to the baby to delivering of the placenta. It will take for the primary mothers 12 hours. So this thing he has to know. And failure of the placenta to come out within the 30 minutes of the delivery, and premature are the pre-labor rupture of the membranes. So before the completion of the gestational weeks, the mother may get the rupturing of the membranes. So that has to be, and any discharge will be occurring on a bloody and the sticky discharge will be occurring through the vaginal, that has to be checked. And painful abdominal contractions. So these abdominal contractions will be occurring every 20 minutes or the less. When the contractions will be occurring, what is the frequency of the contractions and duration of the contractions and severity of the contractions has to know, and the back of the membranes has broken, or any clear fluid will be there or not, any leaking will be there or not, has to be identified. And severe headache during the third stage, third trimester period, or the during the labor period, severe headache or the blurred vision will be occurring. Some others may get convulsions or the loss of consciousness. So these are all the signs, warning signs the father or the partner has to know. So what all that means? Labor duration and failure of the placenta to come out within the 30 minutes, premature or the pre-labor rupture of the membranes, any discharge will be occurring from the vagina, and painful abdominal contractions, and severe headache with the blurred vision, convulsions, or the loss of consciousness. So these are all the things, points he has to remember during the labor period. And he has to know the timing of the delivery. So COVID-19 infection should not dictate the timing. Delivery expect the cases where the potential for rapid deterioration in maternal respiratory status or maternal life is at risk. So we cannot tell if the mother is infected with the COVID. We cannot tell when the delivery will be occurring, and what is the situation that we cannot identify deterioration. And for women with suspected or confirmed COVID cases in early pregnancy, means first trimester or the second trimester will be there, means she can recover. If any no alteration will be there, means at the third trimester, if she will be getting the COVID-19, there is no way, so she has to go for the delivery. That delivery will be emergency cesarean section or induced delivery has to do. For women with the suspected or the confirmed COVID-19 in the third trimester, it is reasonable to attempt to postpone the delivery till they recover. If the suspected case will be there, means we can postpone the delivery. So that delivery can postpone to the administer of the dexamethasone for improving of the lung maturity. So here the obstetricians are the team members has to follow the some of the indications, and so with that the father has to know the timing of the delivery during the asymptomatic time, or the mother will be a healthy. If the mother is having severe acute respiratory syndrome or the middle age syndrome will be there, means he has to be a shift to the ICU. So there, what are the indications for ICU admission? Means respiratory rate will be more than 30 beats per minute, and oxygen saturation below 93. In rest time also, the oxygen saturation will be less than 93% will be the, means she need to be admitted into the ICU. And arterial marginal pressure also has to be checked, and oxygen concentration less than the 300 milli X will be there, means so the mother has to be admitted into the ICU. And coming to the medical management, if she will be in a suspected cases will be there, means supportive therapy. So here supportive therapy including the rest, oxygen supplementation, and nutritional care. So here the partner has to give the, he has to provide the nutritional diet to the mother, and hydrochloroquine in dose of the team members, healthcare members has to administer hydrochloroquine dose of the 600 mg, that is 200 mg thrice a day with the meals, and azithromycin antibiotic for the 10 days has to be administered, hydrochloroquine, and antiviral therapy like a remdesivir, lopinavir, ritonavir, antiviral therapy has to be started. And antibiotics, if the mother may suspicious for the secondary COVID-19, so antibiotics has to be administered for 5 to 10 days. And oxygen therapy, if there is a difficulty in breathing, oxygen supplementation by the nasal prongs or the mask may be provided, and high nozzle oxygen at 4 to 6 liters per minute. So per minute 4 to 6 liters of the oxygen has to be administered, and non-invasive ventilation can also be used. At this point, there should be a re-evaluation of the patient status. When we are administering the oxygen and antibiotics, we need to be re-evaluate the mother, and we need to know the mother condition. And next, coming to the needs of the mother following delivery. After the following the delivery, the partner has to be educate to the mother, provide adequate rest, and need to maintain the balanced diet just as they did during the pregnancy time. So how the pregnancy time, how he provided all the care and advices, the same way following the delivery also he has to take care of the pregnant mother, mother. He has to be provide iron and folic acid supplementation. This should be continue for 3 months after the birth of the baby, and women who are breastfeeding required additional food. So when she is giving the breastfeeding, additional food, additional supplementation and nutrition is necessary. So the partner has to be provided to the mother, and he has to educate to the mother or motivate to the mother, drink more water and encourage to do the postnatal exercises, and he has to advise to the mother, and both has to be talk and plan the contraceptive methods, and they has to go for the counseling process, and they has to take the family support. Both has to take the family support. So these are all the needs of the mother following delivery: providing the adequate rest and maintaining the proper balanced diet, and iron and folic acid supplementation has to continue till more three months after the birth of the baby, and she is providing she is giving breastfeeding, no? So additional food has to be provided, and encouraged to take more fluids, and encouraged to do the exercises, and counseling to take using of the any contraceptive, either the permanent and the temporary, family planning methods, and she has to take the support from the family members and husband. And after the delivery of the baby, postpartum care. After the birth of the baby, postnatal period also, how the during the pregnancy time and intranatal period, how the husband or the partner is giving educated and the motivated to the mother. The same way here also he has to motivate to mother early initiation of the breastfeeding, and consider temporary or the separation for the mother if the mother is having COVID-19 symptoms will be there, means she should be isolated or using the physical barriers. So she should be aware the means the partner has to be encouraged to mother wear the glove and mask, and after that she can give the breastfeed, and then sometimes the mother may goes into the depression, postpartum depression, or the blues will be occurring. So the mother and the partner should give the support and encouragement to the mother. And mother and baby contact. If separate room is not the option, we can permit the baby and mother in a same room. So that time the mother has to follow physical barriers, like she has to wear the curtain, and she has to wear the mask and gloves, and then in between mother and newborn baby, curtain has to keep, and then she has to maintain the distance between the mother and baby, at least 6 feet distance has to maintain, and if no other healthy adults is present for caregiving, uh, no need for separating the baby and mother should put in a face mask and practice hand hygiene before each feeding. The mother should take the hand hygiene and breast hygiene. Okay, and face mask should remain in place during the contact with the newborn baby. So these are all the precautions has to follow when the mother is giving breast feeding to the newborn baby. Next, coming to the conclusion. So during the pregnancy time, when the mother is quarantined and isolated, the mother has faced so many of the problems because of the loneliness, sad. So during the pregnancy time and during the intranatal period, postnatal period, the father will be supporting, and he is present and accessible and available, means actively he is participating, means she should be satisfied, and she should be reducing of the physical, mental, social, economical stress, and she can relieve from that. And when the mother is getting the psychological support, the healthy baby will be getting to the mother. So paternal involvement in pregnancy and childbirth influences the pregnancy outcomes. Means when the husband support will be there, means we can reduce the mother's negative feelings and attitudes and behavior. So we can reduce of the risk of the preterm birth and lower weight of the babies and fetal growth restrictions, and we can reduce of the infant mortality and mortality rate, as well as the maternal mortality rate. So the father and the husband will be involvement. We can reduce the maternal stress by the emotional and logistic and financially, and we need to ensure the men's involvement in their future parent roles from the an early stage. So till now we discussed regarding the during the pregnancy time, what is the COVID signs and symptoms will be occurring, how the disease will be transmitted to person, and to the fetus, how it will be affecting. But till now there is no evidence for affecting of the fetus. And then the partner, how the partner has to be provide the care during the pregnancy time, and what are the advices he has to give during the pregnancy time and intranatal period and postnatal period. These are all the things we discussed. So thank you. My session is completed. Thank you. Any queries?
Aruna? Yeah. Yeah, I think we can end the session, morning session. We can go for lunch break. Where is Viji? Just ask her to tell her. Where is she?
Yes.
Yeah, you can announce the lunch break. So
Yes.
what timing to rejoin again?
Yes,
in the
ma'am.
afternoon? Yeah.
It's 1 to 1:45. It's 1:45. We'll start the session again. I know your session was this wonderful sessions. How the father, the spouse, has to take care of his wife if she has COVID, and what is the effect of COVID on pregnancy, and what is the effects of COVID pregnancy with the fetus, and how he has to take care of his spouse, his wife, in all the various aspects. Is a wonderful presentation. So thank you, Aruna. We'll go for the lunch. With the session will start again at 1:45 p.m.
And you can, Vijay, you can also tell the participants what are the afternoon sessions and
Yes,
what are
ma'am.
the areas to be covered for the afternoon session.
Yes, ma'am. Yes, ma'am. So afternoon we have the session of management of client with as opposed to COVID-19 sequelae among diabetic clients by the speakers of Professor B. Arunakumari, following by the COVID-19 outcomes of post-menopausal women by Professor Smita, followed by the last session today. The end session will be the clients on regular hemodialysis with COVID-19 by Professor A. Lata. So there are 3 more presentations we have by the today afternoon session. Yes, we will start sharing and ending my sessions. Afternoon we will start at 1:45. So thank you all for your patience and so on.
Thank you.